The heart of my passion really was my daughter. When my daughter had a level of 8 nanograms per milliliter for her serum concentration, it was really like seeing firsthand an experiment of what happens to people when they go down in their vitamin D levels. The literature shows that the average point where people start to have suicidal ideation is 18 nanograms per mil. When your vitamin D serum concentrations are low, it is not impacting the amount of genes that it can impact. So if genes are triggered in a negative way, the vitamin D won't do anything with it if you have too low vitamin D. So childbearing age women, it's kind of like folic acid, that in order to have a healthy placenta, you need to have robust vitamin D serum concentrations. When mothers are deficient, it causes a lot of health problems in the child. Other study I read, it even linked it to childhood behaviors. So for parents, get your kids outside.
If you put sunscreen, does that block anything?
Yes, it does. I tend to wear makeup with sunscreen in it, so I have to be very mindful.
Yeah.
If I'm going outside to intentionally try to get vitamin D, I have to pull up my sleeves and to get some skin out there. Yeah. Otherwise, my makeup is going to block it. It's going to block a huge amount of the rays hitting my face.
If vitamin D had a theme song, what would it be?
Ooh, Walking on Sunshine.
Walking on Sunshine.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative, from frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time.
Hello, everyone, and welcome back to the Nurse on Purpose podcast. Today, we're joined by Dr. Beth Sanford, a powerhouse nurse with nearly 30 years of experience across long-term care, women's health, mental health, and hospice. She's a legal nurse consultant who brings warmth and precision to every case, and she's a passionate advocate for trauma-informed legal practice. Dr. Sanford is also a vitamin D expert. Yes, you heard that right, the sunshine vitamin, educating individuals, communities, and policymakers on how this essential nutrient can boost health and improve outcomes. As president of the North Dakota Nurses Association, she's championing maternal health, mental wellness, and nursing workforce issues statewide. Today, we'll be discussing her passion for vitamin D research. So let's just dive right in and get ready to soak in some wisdom and maybe a little sunshine with Dr. Sanford. You're so welcome to the podcast.
Thank you. I'm so excited to be here.
I'm so excited to have you as well. And I remember first time we met, of course, was at a conference earlier this year. And as soon as we met, I was just attracted to your smile. You were such a bubbly personality. And so when we started talking, you really started talking about vitamin D and just you were so passionate about it. And I said, you know what, I don't know why, what is at the heart of your passion, but I would love to learn more about it. And then you shared your powerful story with me. So I really want my guests to hear that today and talk about just what it is that you love so much about vitamin D and how you feel like it can change lives and outcomes in healthcare. So let's start by talking about that. What is at the heart of your passion for vitamin D?
The heart of my passion really was my daughter. I had an experience with her. She, back in 2000, I think it was either 18 or 19, and she was running cross country in high school. And she is, running, going to the practices, going to the meets, doing well, and all of a sudden started to just decline really rapidly. She started going downhill. And she couldn't run as fast. And she said, Mom, I'm so tired. And, we just kind of put it off a little bit, thought maybe she got a bug, or, some kind of bug or something, and she wasn't feeling well. But then eventually it got to be just finish the season. And then it was, Mom, I don't feel good. I'm so tired all the time. So then, we just, I have a holistic background. So we tried a lot of different type home remedies to just try to replenish her minerals, replenish her nutrients, have her eat good, thought the season just wore her down. And eventually we got to the point where she said, Mom, like something's wrong, even in my head. Like I can't focus at school. I feel like I can't retain the content. And eventually I called my friend who was her nurse practitioner, and she recommended doing a vitamin D test. And I thought, what? Like,
right.
Okay. And so we did her vitamin D, and her level was 8 nanograms per milliliter. Now, to give you a reference, the scientific recommendations are that you kind of target between 40 and 60, 40 and 70, kind of is like the baseline physiological level where people naturally land with sunshine if they're around the equator. Right. So if they have plentiful sun, that's kind of naturally where human beings land. So that's what a group of 48 international vitamin D scientists recommends, that level. So when my daughter had a level of 8 nanograms per milliliter for her serum concentration, it was really like seeing firsthand an experiment of what happens to people when they go down in their vitamin D levels. And so she said to me one day, Mom, I really feel like I'm dying. And I thought, what? I mean, it was just so strange.
Right.
And when
she's not a dramatic kid, by the way.
Seriously, joyful, vibrant, no drama. To have her say this was shocking. Yeah. And so then her nurse practitioner prescribed her 20,000 units a day, and she took that. Yeah, it was quite a bit. She took that for 3 months, and she only got up to 22 nanograms per mil. So you can see it takes such a long time when your tank is depleted to restore that. And we were still not near really where that optimal level was, and it took time. And so now even today, she needs to take a supplement during the winter months because we live up in the northern latitudes. So you can't generate your own vitamin D because the rays of the sun don't hit the earth. For certain amounts of time, depending on your latitude. So for our latitude, it's 6 months of the year. So from October to April, we have to supplement up north or else use a UVB device. Or a full spectrum sun device. Okay. And so she tans in the summer because she's got a darker skin tone than me. So she spends time outside getting some sun exposure, and then she takes a supplement to keep her levels normal. And that's how we manage her health. But that really started the research reading for me. So, being a nurse, I just was so interested in the science. So I started diving in, and I learned more about vitamin D deficiency and what types of symptoms, because I saw the mental health symptoms and physical symptoms with her. So I dove in, and then I read an article about maternal health. And it's very interesting because I had preterm labor, and I had I was borderline hypertensive, but I gained so much fluid that I was like I was walking on cushions, and you couldn't see my neck. Like I was very, very ill when I was pregnant, and I was on bed rest for 8 weeks, and I hemorrhaged during birth. This was with my first child, and my hemoglobin was 7. It took me months to recover. 6 months minimum. And I had a very lethargic baby who would not feed. And I was a lactation consultant. So we tried every trick in the book and, used a very professional method to get him to eat for 1 month until he could latch on and feed himself. And so I learned about the outcomes of maternal health. And it was just so shocking to me that no one is testing vitamin D in pregnancy, hardly anyone. We recommend a small dose, with prenatal vitamins, but the research shows it's not enough to get women up into that robust, healthy vitamin D concentrations where we can reduce preterm labor, preterm birth, preeclampsia, gestational diabetes, and infections, perinatal infections, and also postpartum depression. And so the more I learned, the more passionate I became. And so this is why I talk about it, right? Like, I talk about a lot of things professionally with nursing in all my roles, but my passion is to really talk about vitamin D. One of the articles that really impacted me early in my nursing career, I was a hospice nurse, and I saw so many patients, of course, die from cancer. And I came across a really interesting patient that she had ovarian cancer that had spread all over the body. And typically that's very painful.
Ovarian cancer, you
Yeah,
said?
ovarian.
Okay.
That had spread all over.
Mm.
And typically it's very painful. And she had zero pain. And I asked her, like, what do you mean you don't have any pain? And she said, yeah, well, I have my vitamin D level really high. That was the first time I heard about it. So that was probably, maybe 1996. Showing my age.
Vitamin D's been calling out to you for a long time.
It's been calling me for a long time. But how did this, how did she know that? I mean, I didn't even ask any questions because it was just too new of information to me that I didn't even recall it.
Only in retrospect.
In retrospect for many, many years.
Right.
And so, I mean, and, maybe she was an unusual case, but it impacted her pain so much that she didn't have to take pain medication.
Interesting.
Then I read another article talking about the potential to reduce breast cancer risk up to 80%. Like, I mean, are you hearing me?
80%.
Right? So if you have a vitamin D level of 60 or above versus 20 or below, there's studies that show that it was 80% risk reduction. Wow. Now that to me, I buried a lot of women with breast cancer when I was a hospice nurse. And when I read that article, I wept. And I thought, why does every woman know this information? This is why I talk about it all the time. Because I want every woman to know that. And then when you look at colon cancer, about the same. So everyone should know
Everyone should know that. That's interesting.
And so that's why I'm so passionate about teaching people about how to address vitamin D deficiency. It's very simple, but there are some tools that we don't know as healthcare professionals. So how do we share that vision? And that mission of impacting the lives of others.
Okay.
Yeah.
D2 versus D3. What should people be taking? D3.
Yeah.
Okay.
So from a supplement perspective, we take D3 because it's like the receptor is shape of a stop sign, and we want to take the supplement that's the shape of the stop sign.
Of the stop sign.
So it hits the right points, right? And if you look at the literature, you can see that the impact of vitamin D3 is the most on patient outcomes, and it's the one that's been the most studied. And so that is we take D3.
What is D2 good for?
It's used really sometimes for other things, but it's really not used much anymore. It's really, you really want to focus on the D3.
On D3.
Yeah.
As your daughter was taking the vitamin D supplementation, 20,000, was she getting better as her levels were rising?
Oh, yeah.
Wonderful.
Oh, noticeably. Like, I think after maybe 2 weeks of taking it, she said, Mom, I'm really starting to feel better.
Wow.
And that was just after 2 weeks.
Wow.
And so, and she probably was feeling better before that, but just noticed such a vast improvement after 2 weeks. Yeah.
That's
and we've through the quality improvement projects that I've done and some of the other advocacy and just hearing people give feedback, people really do feel an improvement quickly if they have vitamin D deficiency.
And she still wasn't even at optimal levels yet, but already starting to feel better than she was.
The literature shows that kind of the average point where people start to have suicidal ideation is 18 nanograms per mil.
My goodness.
So she was at 8.
That's why she felt so terrible.
That's why she felt terrible. And then over the years as nursing faculty, I usually do talking about vitamin D for students because, of course, the memory, retention, the executive function, the creativity, innovation piece, like getting your brain to click, right?
Yeah.
And remember what you learn. Right. My daughter says that's a huge issue for her. If she doesn't take her supplements, after a while, she can tell that she doesn't retain information the same because she's still in school. She's in college. And so she's really, really has to be very diligent about taking it. But the mental health and the suicidal ideation, I mean, there's a very nice inverse relationship with vitamin D serum concentrations and, psychiatric behavior, and mental health behaviors and suicidal ideation. And so it's a very important from a mental health perspective. It's why I really focus a lot with educating if I run across a psychiatric NP or a psychiatrist, I really hardcore talk about vitamin D because it's such a nice addition to what they're already doing for their care, but just to manage the vitamin D levels and then appropriately supplement to get that vitamin D level into robust, that your patients will just have so many less symptoms, anxiety, depression, OCD behaviors, with bipolar. I mean, there's just so much out there, and we need to get people in the sunshine because, of course, sunshine has a broader spectrum. And so you're not just getting the benefit from the vitamin D, you're actually getting you have the whole orchestra when you're out in the sunlight. So we just all need to spend more time in sunlight. But it's hard when we work night shift, have indoor jobs. It's more challenging to get out in that middle part of the day when you can generate your own vitamin D from the UVB rays. And people often say to me, I had a physician recently say that his primary care physician had told him, oh, you're getting enough vitamin D when you walk your dog at night. And actually, that's not true. The sun science shows us that UVB is midday. So while he's getting other rays of the sun and benefits from those, which are many, he's not getting the UVB benefits, which is the generating of vitamin D when he's not outside during midday.
What's the nice little window? 10 to 3? What is it?
10 to 3, 10 to 2. You want the ultraviolet, the UV index to be 3 or above. So I oftentimes will check on my phone, like what's the UV index right now in ABC city I'm at, just to make sure that it's above 3 if I'm intentionally going out to generate vitamin D.
And you check that on like your phone on the
I just check it on my phone. I just type it in. Sometimes you have weather apps that'll just say it on there, like, oh, the UV index in your city is this today. Because if you have cloud cover or if you have other inclement weather, it can lower the UV index. So I use that as my own personal marker, and then I just intentionally try to get outside. Like I haven't been outside today yet and it's noon where I'm at. And so I'm like, ooh, I got to make sure that I'm going to go outside and, because I'm Scandinavian background, so I'm fairer skinned. So I need less time in the sun to generate a good dose of vitamin D versus, some of my friends from the New American community who are Sudanese or Somali that are darker skin tone, they need more time. And so it can be the difference from 15 minutes to an hour and a half to generate the same amount of vitamin D.
That's so amazing to hear, depending on where you live and depending on your background.
Yes. So we really need to be cognizant of that as healthcare professionals, of if we have clients that are from their ancestry is around the equator and now they've moved up to a northern latitude. I have a very big story about this. I had a woman approach me who was a nurse practitioner school, and she had a daughter who was struggling with some mental health concerns. And she took her to the physician and said, would you check my daughter's vitamin D level? Like we're from African ancestry and we've just moved to North Dakota the last couple of years. And the physician refused to draw the vitamin D and gave an antidepressant, which I'm not against antidepressants, but I do like the baseline physiology to be addressed as well, right?
Absolutely.
And so mom took her back 3 months later and her vitamin D level was like 10. So again, but when suicidal ideation starts around 18 and we're seeing people in the those really low levels, I'm the lead researcher for the North Dakota Vitamin D Project, and we are seeing very low numbers in our residents in North Dakota. And so I've seen people that had undetectable vitamin D.
Wow.
I mean, and their symptoms are phenomenal and nobody is catching it. They're giving them medications for all these things, but they're not addressing the core roots. So we need to really be thoughtful about that.
It's fascinating because of how simple the solution is and how simple it is to diagnose.
Yes.
Right? You draw a level, it's quick, it's easy. You get the result in 2 days.
Right.
You get some vitamin D from the store.
Spend some time out in the sun.
And spend some time out in the sun.
And then follow up test in 3 months and see where you're at, There is an evidence-based vitamin D calculator that I recommend to healthcare professionals that you can find on grassrootshealth.net.
Grassroots Health,
grassrootshealth.net. And they have tested this. This is based on the formula in the research. And what I love about it is that I've shared it with a lot of practitioners, and I have a family medicine practice way in northern Minnesota that's using it with their clients. And they said it's just so easy.
Yeah.
Now they don't have to guess. And what they found is that they were underdosing people. And so now they can appropriately put in the client's weight,
right,
and what their current serum level is, and make a suggested amount of vitamin D, or else they can just do the person's weight and suggest an amount of vitamin D and then test in 3 months and see where the person falls. Because everybody metabolizes supplements a little differently, depending on what your microbiome is. Are you taking in medications that leach vitamin D from the body?
Right.
There was a really good article by Wakeman. Oh gosh, what year was that? 2018 or 19, that goes through the list of medications that leach vitamin D from the body.
Vitamin D. Oh.
So we have to be very mindful, of that we're doing the whole picture with people. And are the medications that are being prescribed leaching vitamin D from the body? And so that's really one of my passions about educating healthcare professionals is, again, what are you prescribing? Is there any nutrient? Because they could be leaching something else, magnesium, B vitamin, something else, right? But all of those nutrients are really important. And vitamin D is not just a hormone, it's a cell signaling molecule. So it actually is about communication between the cells. So we're preventing the cells from adequately communicating if we don't have enough vitamin D. Drop the mic, right? Not just that, when your vitamin D serum concentrations are low, it is not impacting the amount of genes that it can impact. So if genes are triggered in a negative way, the vitamin D won't do anything with it if you have too low vitamin D. But when you got your vitamin D levels up in that robust, mid-range, the 40 to 60, 70 range, you can impact, we're in the thousands of genes. That vitamin D can actually regulate them. And it's like a light switch. It can go, oh, this one is supposed to be on. Click. This one is supposed to be off. Hook. Because vitamin D has that genomic activity. And that is so, that I can see your face. Like that one's a thinker. Okay. Like we're talking, I have a family history of breast cancer. Okay. We have premenopausal and postmenopausal breast cancer in my family. Why would I want to have low vitamin D? No, because then my genes aren't going to be triggered in the toggled on or off in the correct way. Right. I want my daughter and my nieces, any woman in my family to have their vitamin D in that good range so that they can have it toggled in that way that is maximizing our genetic potential.
Now, there are some medications, for instance, folic acid is a supplement, it's a vitamin. We have to increase our dose in the maternal, in the maternal years and the natal period. Is vitamin D the same where there are maintenance doses and then dosing based on whatever it is, condition or situation that your body's going through?
So childbearing age women, it's kind of like folic acid, that in order to have a healthy placenta, you need to have robust vitamin D serum concentrations. There's lots of literature about that. Like I could get 2 big textbooks about it. It's a lot of literature on that. So childbearing age women, if we are like a women's health nurse practitioner or nurse midwife or NP or OBGYN working with that age group, we really want people to be on to have their serum concentrations in a healthy space before they get pregnant. That would be optimal. Right? That primary prevention, which is why in North Dakota we introduced our legislation to address vitamin D deficiency from a primary healthcare perspective. And got it passed. Largely it's because the maternal health advocates came out of the woodwork to say, absolutely, yes, this is a fact. And so,
what does it have to be before you get pregnant? You
really want to make sure, again, it's individualized
based on,
you want it because some people, like maybe somebody needs to take 5,000. Maybe if somebody is heavier weight, maybe they need 10,000 a day in order to achieve that kind of optimal serum concentration of the 40 to 60. Research shows if your level is 40 when you give birth, you can have up to an 80% reduction of preterm birth.
Wow.
And so for our maternal health advocates all over the world, like, hello, cheap, safe, easy. I mean, the researchers, Hollis and Wagner, have been researching this for 20 years. Read their papers.
Wow.
That's what I read. I read
Yeah.
Hollis and Wagner stuff, and I just all the time am blown out of the water at what they find. I'm just good at talking about it, right? But they did it. It's amazing. The other thing is, you have like kind of that main physiological level of vitamin D, like I said, of what people can naturally generate from the sun. So when you look at traditional populations, like living traditional lifestyles in East Africa, their normal vitamin D range is that 40 to 60, maybe even around 70. Pregnant women, their normal range is 55 to 60. So we know that serum concentration, and they're getting that. They're not sun tanning, like they're avoiding the sun at that latitude, right? But they're still very robust levels.
Yeah.
You can use vitamin D like in a like a pharmaceutical way under a doctor's supervision. Dr. Coimbra from Brazil has a fantastic protocol for autoimmune disease for multiple sclerosis.
Okay.
That is worth researching if somebody has a loved one or patients with MS. They've found fantastic things, even like hyperthyroid. Where the autoantibodies have triggered, you want to keep the vitamin D in a more robust state. Cancer, the vitamin D and cancer experts of the world, Munoz and Grant, recommend in their paper, they highlight research that recommends around 80, keeping the serum around concentration around 80.
Wow.
So it really depends on what the person has. I would say it's always ends up, we can do our public health projections.
Yeah.
But it comes down to the person.
Yeah.
Right. What is how does the individual's person respond to sunlight and vitamin D supplementation? How do we keep them in that perfect serum concentration? Right.
Yeah,
I mean, if I could redesign a hospital, I would redesign them with all windows that you can open, having a beautiful atrium for patients, and get patients outside in the sunshine, because sunshine is a healer. We know that historically. Right.
Yeah.
But if people are in a long-term care setting where they can't get outside themselves, then we need to look at other things. Do we need to look at sun lamps? Do we need to look at vitamin D serum concentrations? I just worked on a successful quality improvement project in a hospital where we pulled serum concentrations up to 50 and then tracked patient outcomes. And that was just put on YouTube, their interview of the hospital, Vibra Hospital in Fargo, North Dakota. They're fantastic patient outcomes. And probably a couple of my favorites where they had someone who wasn't expected to wake up out of a coma and woke up. Another one was another person who had a very serious health condition that was not expected to survive that, and they survived. And that they have more patients going home versus going to long-term care.
They're doing IV forms of vitamin D.
No, they were doing oral D3. Yep.
Okay.
That's what they were doing. I mean, that and that protocol is out there for anybody to see, for anybody to do in their hospital as a quality improvement project. And I do consultations as well for quality improvement projects in the hospital, because it's so exciting to see patients' lives changed.
Yeah,
right? Like those people got their children back.
Yeah.
Like incredible, right? Incredible. So exciting. They got their children back. They didn't have to go home to long-term care. They got to go to rehab and then get to go home. So it's exciting. It's exciting to see what addressing baseline physiological science can do.
Yeah.
It's fun.
I mean, you are answering all of my questions even without me asking them. Like, this is amazing. Right. So I want, for those who are my listeners who don't have a healthcare background, for instance, and just want to know, right, and you may not be able to run down the whole list, and just want to know, what are some diseases that vitamin D can help to manage or prevent? If you can just give me a list, you can give me 10, 15, whatever. So maybe somebody will hear their symptom or in there.
Correlated to so many things.
Okay.
So I'm writing a paper with a group in Dubai right now on women's health, and we're talking about PCOS, endometriosis, all the maternal or all the female health things, right? Female health issues, hormone balancing, hormone management, weight management, appetite, natural appetite suppressant. sunshine.
Okay, girl, that's now we're talking.
I know, right? Well, I saw that and I was like, ooh. And then it's the next skincare ingredient to prevent aging. Like I was like, unbelievable when I read that article. They're like, we recommend this to prevent skin aging.
No.
And I was like, can I start a company right now with skin products infused with
For
vitamin D?
real, for real.
Oh, it's already there. Somebody else already did it. So yeah, and so I just do vitamin D drops and put them on my face. Actually, that's what
we need to talk. Oh no, actually, I was going to say let's talk offline, but we are going to talk here because I need the listeners to hear all the beauty secrets too.
Yeah, but one of the other things from the cardiology perspective that I think is really interesting is D3 acts right on the lining of the vessel to repair it if there has been an injury. D3 itself, not a metabolite, D3.
Wow.
So that's why, again, like I think rural area, right? I'm from a rural area. We have a lot of long time rides in the ambulance for our people. If our vessels can be stronger, we have an opportunity to make it to the hospital. So I want my people to have strong blood vessels because I want them to get there.
Yeah.
Right?
Yeah.
And so, even reducing MI risk, reducing stroke.
Yeah.
I have a great story that was tough to deal with, but my mom recently had a stroke. I keep my mom's vitamin D levels really robust, and thankfully we got her to our critical access hospital. They were able to give her the clot buster. She did have some hemorrhaging, but she went in with a stroke score of 24 and walked out with a 0.
No.
And I'm telling you, this is, the example of precision medicine and peak nutrition at its finest.
Absolutely.
Right? My postponing or preventing dementia.
Wow.
Okay, here's another one.
Yeah,
if
I remember
you have
the
low
story you
vitamin
told me
D in
about
your life,
that.
you are more likely to have dementia as an elder.
Yeah.
And my own grandmother, we got her vitamin D levels up to a nice, robust level. And about 2 months into that, one day I called her and she's like, "Oh, hey, how are you?" I'm like, "Hi." And I said, "Well, what's going on, Grandma?" And she's like, blah, 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 telling me. And I thought, Grandma, you just sound like you're 75 years old.
Yeah.
And she was 95.
Wow.
Like her cognition changed.
Wow.
And so, the only thing we changed was that. So I really, I can't.
I have a hard time remembering things. Should I be taking vitamin D?
Yeah. Oh, I think everybody should be getting outside. Everybody follow the literature. The literature says we need to have our levels there. So whatever it takes for you to get there, whether it's supplementation or sunshine. Now food, we haven't talked about that yet, but food is not very high in vitamin D.
Yeah.
So a piece of salmon, for example, you'd have to have 10, standard pieces of salmon to hit 5,000 units a day.
Yeah. And that's what you want to do is 5,000 a day. That's the recommendation for the day.
Well, the Canadian Vitamin D Society recommends about 4,000 for their people, but that's an older recommendation as well. Okay. I find for weight-based, for most people, like when you use the calculator, most people end up, I would say, between the 5,000 and 10,000 by weight-based. But you really want to work with that in collaboration with your healthcare provider because you may have something going on in your life where you can't have a vitamin D level of 40 to 70, especially if you're a renal patient, maybe they want to keep your levels closer to 30. So that's why we want to have healthcare professionals knowledgeable, have healthcare professional levels, have this conversation with their patients.
Right.
And so that they can have that trust that they know the latest vitamin D science and that they're using it in their practice. Right.
Because it's possible that your vitamin D can be too high.
Yeah.
Depending on
your personal health conditions.
Right.
That's why individualized care
That's why it's important.
Is number one. Right. Okay. But then there's some people that they would want to have a higher level. So that's why it's really based on your individual, what's going on with the patient. And so that's why I always recommend, let's inform the healthcare professionals so that they can do a great job with their patients. Yeah. Right.
But grassroots helps to tailor, especially if you are, all things being equal, you don't have any health conditions. You can use that grassroots health calculator to check where your dose should be or where your levels should be.
And I always tell people, show the calculator to your doctor.
Yeah.
And say, hey, look at this. This International Research Institute created this tool for you to
Right.
use to help me,
Yeah.
you know?
Yeah.
And so, yeah, so
Yeah.
that I always, educate
Okay.
from a public health perspective, educate our healthcare professionals, educate our up and coming
Mhm.
healthcare professionals. We just need to educate everyone about vitamin D and
Yeah.
sun science. That's
Yeah.
my mission.
I
Yeah.
have a friend whose daughter recently was in a car accident. Thankfully, no broken bones, none of that. But she sustained really bad TBI, and she's kind of been dealing with some anxiety and some depressive symptoms because she's not able to do some of the activities that she loves, like swimming. That's her love. She loves to swim. She's always in the water. She can't do that. She's anxious whenever she gets in a car to drive now. Is that something that vitamin D can help with? Can I give her like advice on managing those symptoms with vitamin D?
Now, because you're a nurse practitioner, you have a great opportunity to help educate patients about the
Yeah.
benefits of that. There was some really great work on traumatic brain injury and vitamin D done in Georgia by Dr. Leslie Matthews.
Yeah.
And what he found is that if people have if you address vitamin D deficiency right away in people who've had traumatic brain injury, it can help reduce their symptoms. And so, because one thing is that vitamin D does is it's a regulator for the inflammatory processes in the body. So one of the quality improvement projects I would love to do would be to do in an ER, and anyone who comes in who's had a car accident, to give them IV or injectable vitamin D,
Yeah.
and then to monitor their outcomes, because it would help prevent the swelling in the brain.
Right.
And so there's so many studies about repairing the brain with vitamin D and omegas and omega-3.
Yeah.
So think of that as that nutritional support to help the brain heal.
Yeah.
So we want to be doing that holistic approach to patient care, so that we are looking again at those baseline physiology levels. So if your friend's daughter, for example, had low vitamin D, that would be a great opportunity to correct that.
Yeah. And it was low because I asked her.
Yeah, to correct that so that her body can use that vitamin D to heal.
Yeah.
And so one of the other projects that I did was with wound healing. And what we found was, when you get those vitamin D serum concentrations up to around 50, the wounds just go whoop, heal up,
Wow.
surgical wounds, pressure ulcers. 50 is kind of the magic number for getting wounds to heal. So think about somebody who had major trauma in her body, like your friend's daughter. That's just giving her body that nutritional support
Yeah.
that it needs to heal. And if she went outside and spent time in the sun, that also would help her body, because she's getting, again, the full orchestra of the benefits from the sunlight, not just one instrument per se, which is the vitamin D.
And I could take her weight, plug it into the Grassroots Health calculator, and figure out what would be a great dosing for her, and then kind of guide her that way.
Yes.
Awesome.
Yeah, I can't say enough about Grassroots Health. I'm on their advisory board now, but when I was in the beginning, when I was just beginning vitamin D research, I reached out to them and got a whole bunch of resources and support from some of the world's most famous vitamin D scientists, who really, without their mentorship, I would not know what I know. I would not be able to share what I share. And they really put the knowledge and wisdom behind my passion. And so I'm so thankful for them. Just a wonderful group of people who are just love human beings and really want the best for humanity. They advocate for lower vitamin D testing costs, again, very affordable test. I mean, a whole year of vitamin D supplements at 5,000 units a day is like $10. So this is safe, effective, affordable way to help our population be healthier. The U.S., we're in a little bit of a tough situation with our health, compared to the other developing nations of the world. And, as a person who's worked with maternal health, I said as a lactation consultant, worked with postpartum moms. I'm really passionate about those maternal morbidities and mortality. And I feel like for the developing nations, we're very low. The March of Dimes scored all the states, and North Dakota got a C minus. I'll tell you what, I don't like being a C minus. So, so I reached out to a couple hospitals in my state just last week and said, hey, do you want to do this maternal health project? Because the research shows that it's going to work. And then, we'll be up in that A+ range, which is where, this book nerd really likes to hang out in the
Yeah.
area. So yeah,
Well,
I'm just excited.
as the president, you've already been able to pass some really fantastic legislations, for maternal health. Let me just allow you to speak a little bit about that.
Yeah, so the North Dakota Nurses Association, I'm telling you, we have a great team who really worked this year on our advocacy platform. And so we joined some other stakeholders in the state, the North Dakota Medical Association, who I just want to give a big shout out to, that they really have advocated for the workplace violence bill for many, many years in North Dakota. And we finally got the verbiage to a place where the legislators were in agreement. And I'm really excited to say that passed. And so it's now a felony in North Dakota to assault a healthcare worker in a hospital setting. Yeah. And so, more advocacy to come, but we're really excited about that step in the, right direction to get it covered for some settings. We're just really excited about that. Like a lot, some of the hospitals really worked hard on it. We testified on that bill. I'm very excited. Executive Director Sherry Miller testified. She's testified several legislative sessions on that. We're very excited about that. Nice. The second piece of legislation we got passed this year was a bill. So we have a state fund that helps to fund higher education for North Dakotans. And it's called the Career Builders Program. And so it's like a matching type program. Like you can get the school or the employer, and then you have a match, and the state will match. So then it will either do tuition assistance or loan reimbursement, depending on your situation. But it's normally for only undergraduate programs. Well, we're dreaming big this year. And I was at a nursing meeting and I said, well, what if we could get Career Builders to cover master's degrees in nursing?
That's right.
Because we need nursing educators. And in North Dakota, in order to be a faculty member for RN students, you have to have a master's degree. And so we were just dreaming big, and we got this idea going. So in lieu of teaching clinical, you can get your student loans reimbursed, or you can get tuition assistance. Like, it is one of the few programs in the nation for funding master's degree nursing education. So that being said, wherever you are in the U.S., if you want to come and get your master's degree paid for,
awesome.
Come on to North Dakota. And the other thing, we have 3 counties out in the West that your high school students, if they graduate from those counties, can get 2 years of education completely paid for.
Wow.
So that means they could walk out with a nursing, an RN, a 2-year RN degree, an ADN degree paid for.
Wow.
Yeah. Come to North Dakota. I tell you what, we got a lot going on.
I come over there and do my doctoral degree.
Well, I tell you what, there's a lot of we got so many good opportunities. We have so many jobs available.
Yeah.
A warm community, lots of opportunity. I always tell people, come to North Dakota and live. Like, we've got a good place.
Yeah.
we got it going on up here, and it's really, we don't want it to be the best kept secret of the U.S.
Thank you for, putting North Dakota nursing on such a great platform. Let's talk about the last legislation, the vitamin D.
So this is a piece of legislation we've worked on for many years as well, for two sessions. This is the third. This is probably 4 years in the making. We put out a concurrent resolution to address vitamin D deficiency from a primary health perspective, because North Dakota, being up north, has those unique environmental risk factors of, we have inclement weather. We have tough winters up north, right? And then at our latitude, because the rays of the sun don't hit the earth at our latitude to generate vitamin D for 6 months of the year, we need to get that education out. That sun science needs to go to healthcare professionals and to patients, right? That this needs to be addressed. And it's a health issue. One of the issues that we had in the legislative session was talking about our huge Medicaid costs for dental. And so I said, hey, I heard you guys were talking about this bill, but I was testifying on the concurrent resolution. I said, if we give our pregnant moms, if they have more robust vitamin D levels, they have children with better teeth. It costs the state less money. So this is, it's an up the pipeline solution to address vitamin D deficiency as primary prevention.
Right.
And so the concurrent resolution passed. And so we're very excited.
That's awesome.
Just opens the door for more advocacy, research dollars, education, great opportunities to make North Dakota healthier and people happier, and really to spread the message all over the U.S., right?
Yeah.
That this is a priority, and it's a priority. Primary prevention is important and is a priority for the health of our people.
That's wonderful. Speaking of kids and their teeth, I'm a pediatric nurse practitioner. That was my background. What would you tell parents? What would you like parents to know about vitamin D in children, starting at infancy, toddlerhood, school age, and on like that?
Well, there are great recommendations from the pediatric experts that are from newborn that we should be giving children vitamin D drops. The reason that is because mothers are deficient.
Right, exactly.
That is the reason.
That's the reason.
Number one, they're trying to prevent autoimmune things like diabetes type 1, cancers in childhood.
Right.
It even shows that when mothers are deficient, it causes a lot of health problems in the child.
Infant.
Other study I read, it even linked it to childhood behaviors. There are studies linking it to autism. There's studies linking it to many, many things. So for parents, get your kids outside.
Yes.
Understand where you live, the geography of where you live in the world, and can you make vitamin D in the winter, or not? Because in North Dakota, I could go outside, and even if just my face is showing, I'm not going to make any vitamin D because the ray of the sun isn't hitting the earth. And so, and research shows that even if I take a vacation and go to, Jamaica, right, for 2 weeks, I'm not going to generate enough vitamin D to bring my levels up to a robust level. And that research was done out of England many years ago. And so we need to get our kids outside. It's good for their health in general. It's good for vitamin D levels. It's good to prevent obesity, get people walking, moving, spending time outdoors. Supplement if you need to, look at, like I said, talk to your pediatricians, talk to your NPs, look at where you're at in the nation and follow those general guidelines. But, make sure that you know where you're at. I have a friend who is a nurse practitioner, and she gives her children 2,000 IUs a day because she thinks the recommendations are too low. And she noticed that when she bumped up her kids' vitamin D, they were sick less and missed less daycare. So that, it can impact workforce issues as well. Our parents having to take sick days to take care of sick kids. So even from a state perspective, that was one of my conversation points to the state was it actually can prevent excess sick days because the research shows that it prevents respiratory infections. So very, very, very wide range.
Especially during the winter months.
Yeah, right. And you think if the winter months, we're having less sun.
Right. So we're obviously going to have that.
Yeah, we're having a vitamin D. We're having a vitamin D winter, right? Yeah. And then in the southern states, during the summertime, they create their own vitamin D winter by staying indoors. So we as healthcare professionals need to know our states and know our people. And especially public health officials, like we need to know our state, know our people, and know our people's typical behaviors and trends. We've had people move from other areas of the world, so we have a lot of women now that are covering their hair and covering a large part of their body, so they're not getting as much sun exposure either. And I talked to a woman who had undetectable vitamin D levels, and she was terribly depressed. And so I, gave her some education on getting outside and talking to her doctor about getting her vitamin, what to take for vitamin D. And because she's from Muslim background, to find a vitamin D that's halal so that she can take it. So that gave her a new sense of hope to know that.
Are there any specific brands that you?
I just looked on, for her, I just looked on Amazon to see which ones are halal. And they usually list and have a symbol on there.
Okay. Yeah. Perfect.
So otherwise, you kind of depends on what people are needing. I am a healthcare professional, so I do kind of more of a healthcare professional brand where I get a discount. But I know there's lots of companies like Swanson's Health. They have sales sometimes, and you can get vitamin D 5,000 units for 3 cents a pill. It's pretty cheap.
Wow.
Yeah, it's pretty cheap.
That is cheap.
Safe, easy, effective, affordable. That's what I always say. And research shows that it reduces overall healthcare costs. Wow. So if you feel like I'm spending too much money with my family for healthcare costs, you may want to have your healthcare professionals draw vitamin D levels to see where people are at.
To see where you're at.
Yeah, because it could be that you're low, and that's why that's why you're, getting so many more respiratory infections. Of course, with the normal things of wash hands. And
Yeah.
I think it's really important to think about the symptoms that people experience when they're having low vitamin D that they might not be knowing is vitamin D symptoms, because they overlap with a lot of other things. But, muscle aches and pains, joint pain, low back pain, fatigue, lack of mental clarity and focus. I think this is where we really get into the pediatric, where people are automatically prescribed medications for ADHD instead of looking at something like what could a vitamin D deficiency manifest as is lack of focus, lack of clarity, the lack of motivation to do things. So that avolition, like not having any motivation to do anything.
And this is male and females. Not just
fatigue. When I do presentations for nursing staff, I always focus on, if you work nights, you've got to no matter what, you got to stay on top of your vitamin D. But the night shift nurses are always like, oh my gosh, that's me. That's me. Yeah. Because when you do shift work, you're more likely to be vitamin D deficient or an indoor worker in general. But because they're sleeping during the day, right? They're sleeping during those peak vitamin D hours. So those symptoms, I think the cognitive impairment, the pseudo dementia can be very dangerous when you have a job that then where you're liable for what you're doing. Like for drivers, people who are long distance drivers or, driving people around in their vehicles or healthcare professionals. If you're liable for what you're doing, you want to make sure your vitamin D levels are robust so that your brain is working, right? You have maximum cognition. Yeah. And just the fatigue, the pressing fatigue that people that I've worked with have talked to, the pressing fatigue of having low vitamin D, extreme pain, migraine headaches, muscle aches and pains, things like that. So
these really are all indicators that your vitamin D might be low.
Yep.
Rheumatologic conditions like osteoarthritis, rheumatoid arthritis, lupus, all of these things too.
Yes. And especially if they have an autoimmune component, then remember vitamin D impacts those autoimmune response. Another thing that I had read that I thought was really fascinating was how vitamin D impacts the cortisol response. So if your cortisol gets triggered and if you have really low vitamin D, your body can't stop the cortisol wave. And whereas your body, if you have robust vitamin D, it will minimize some of the symptoms that you might have from high cortisol. So just even that, the body's stress response.
Right.
And of course, our patients are experiencing a large stress response when they're hospitalized, but also in everyday life, if we are experiencing stress, for whatever reasons, we want to have our body be able to maximize that stress management. That's where things like vitamin D, magnesium, B vitamins, omegas are really critical to support the stress response.
I'm still stuck on this appetite suppressant thing. That's where I'm stuck.
I read this article just last week, maybe, because I'm researching a little bit of how vitamin D supports the healthy the GLP, right?
Yeah.
And so, if your vitamin D is really low, that's a problem for weight stability and weight loss.
Right.
So we want to have people have a robust vitamin D. And sunshine, the article about sunshine and the appetite suppressant component of it was really fascinating to me. And then also, of course, how vitamin D helps with the insulin sensitivity. So if you have really low vitamin D, your body is not as sensitive to insulin as it should be.
So there are some medications that will decrease the effect of vitamin D or deplete the body of vitamin D. Are there any vitamins or minerals that will potentiate the effects of vitamin D? Like if you took something along with vitamin D, it would help boost.
So you typically, when we recommend, in the healthcare profession, if somebody is prescribed vitamin D, they're also prescribed magnesium. And eat magnesium-rich foods. K2 is also a nutrient that's recommended when you're taking vitamin D to help the vitamin D go in the right places.
Okay.
And Kerrygold butter actually is grass-fed butter is a great source of K2. So I actually just eat butter. That's what I do. That's how I get my K2. I don't take it as an artificial addition to the supplement. I just eat Kerrygold butter.
Just eat Kerrygold.
Yeah.
Wow.
Yeah. Yay, Ireland.
Yeah.
Yeah. But they actually advertise that they have K2 in their butter. Otherwise, but I do Amish butter too sometimes. But I just eat grass-fed butter.
Yeah. That's awesome. I'm thinking I will start doing, because prenatal vitamins, I take them year round anyway, but they're usually like 600 IUs. I might just get another supplement that will be like 5,000 a day. I'll check.
Yeah, I think when you do the grassroots health calculator, you'll be surprised, because the recommended newborn dose is 400 IUs. So that would be it's too small for an adult to take 400 IUs.
Yeah, of course. Of course. Your friend that's giving her kids 2,000 IUs, how old are they? I have a 2.5-year-old.
She had two and 4-year-olds.
And they can take 2,000.
You can do do the weight-based calculator.
Okay.
Yep. Do the weight-based calculator. And, because, some kids are really petite, and she had some real big boys. So she.
Yeah. My daughter is, she's slim, but she's solid. Like, you lift her up and I'm like, she's muscle. She's muscular. I don't know. She's 2, but she's muscular, but she's pretty heavy. So I think she would probably be about 35. She's about 35 pounds now.
Yeah. So use the calculator. Entirely appropriate.
Okay. Perfect. Okay. Yeah. Perfect. What else did I want to ask you when you came? I really wanted to know maternal wise. That was why I was asking, because I'm at this like childbearing age now.
Couples are struggling with infertility. Check the male and the female's vitamin D levels, both. Because research shows if men have low vitamin D, they don't have the sperm quality. Yeah. I mean, I tell you what, I love reading research papers, because I always find such interesting things.
Wow.
But also for females, we want those eggs to be healthy, right? Like the healthiest, and the environment in the uterus to be healthy.
Yeah.
So we want to have, that high vitamin D nutrition to support those tissues, and to be, and the maximum genetic potential of those, the sperm and the egg as well. So really important for people who are struggling with infertility or even thinking about getting pregnant.
Wow.
Yeah. So, go outside as family, right? Go outside together. Like for you guys, go out together, right? Go outside together and try to spend time outside together, and, look at your vitamin D levels and make sure they're robust. But there's a fantastic article, that was written, by Dr. Hollis and Wagner, talking about the substantial amounts of vitamin D that are required to have a healthy placenta and a healthy pregnancy. They recommended in that article 5,000 units a day for childbearing age women and pregnant women.
5,000 a day.
Yeah. And so you can find that article easily on PubMed. I think it's an open access article, but I love that article. And they say in there that vitamin D is the only known substance to prevent preeclampsia. And I just think about all the women that I know that have struggled with preeclampsia, or women that have died from complications from preeclampsia. And I think it's very serious for us. And I mean, with the amount of robust literature that's available about the negative consequences of vitamin D deficiency and insufficiency in pregnancy, I think we're almost getting to the level where it's ethical that we are educating our patients on this.
Right.
Yeah.
Right. Wow. I feel like the right vitamin found you and you're stewarding it well.
I tell you what, I just, that's my prayer every day. Just help me to be a good steward of the knowledge that I have, and help me to communicate it with wisdom and grace. Right. I mean, if we love people, we want people to be well.
Yeah, for sure. Yeah. I think you should form a coalition for vitamin D researchers or champions, and have one in every state, eventually like expand, and then each person can do what you're doing, which is getting bills to be passed, and educating. Maybe go from hospital to hospital, or whatever. I think that would be such a wonderful, just when you build your website or whenever you are fully set up on there, you can be like, all right, this is the coalition for, whatever. It could be a healthcare coalition, and then nurses from every state can just come on and Yeah, I think that would be a great thing to do because the message is so simple yet so effective and profound.
Yeah, and so unknown.
And
It's really
unknown,
interesting you
right?
say that because I actually have thought of that many times that it would be great to have a
Mm,
national coalition with a
yes,
champion in every state. And whether
yes,
we do it through like the nurses associations or through interdisciplinary collaboration of just whoever is interested in being a vitamin D champion, this must be a divine sign because that is that's been on my mind is that's the
yeah,
fastest way to get it done. Like I
yeah,
like to get
it
it
is.
done. Like
Yeah,
I'm
because
just a get it
you're
done
one
person.
person and you're
Yeah.
doing such great work, but there's only so many people you can reach by yourself, right?
Oh,
Jesus had
absolutely.
disciples.
Yeah.
So you can make your own disciples all throughout the country. It would be wonderful. And then internationally, it could grow too, because you're already connected with nurses in Africa, I
Yeah,
don't
Middle
know,
East. Yeah,
the
I
Middle East,
connect with
right? You
people in the Middle East.
mentioned.
I have some
And
people, yeah,
so there you
various
are.
parts of the world. But
So,
and there's really some very good vitamin D research going on in Iran right now, also.
mhm, mm,
And other countries in the world too are taking more of a notice of the impact of vitamin D deficiency, specifically on maternal outcomes, because of course we're looking to improve maternal health comes out across the world. And
yeah,
so I'm happy to see that there's many researchers now that are,
can add
looking
that.
at the consequences of vitamin D deficiency in pregnancy
Yeah, for sure.
and just the whole perinatal time period,
Yeah,
you know,
yeah, yeah.
because in the developing world, of course, women die from different reasons in maternal outcomes than they do usually in the developing world. A lot of times it's more like hemorrhage is one, but
Yeah,
then vitamin D addresses hemorrhage, right? So I feel like it's the nice over encompassing a lot of the issues, right?
yeah,
But
yeah.
it encompasses issues from developing nations and
And then
developed nations.
postpartum depression too,
Yeah.
which a lot of people
Yes.
deal with, but may
Yeah.
not even recognize the
Yeah.
blues, progress into the depression.
I don't know if I've told this story, but my great grandmother, one of my great grandmothers was a midwife, and one of my great grandmothers died in childbirth, and they lived like 14 miles apart. But of course, in horse and buggy days, that was very far, you
Yeah,
know.
yeah,
And so I grew up with this legacy of both of my great grandmothers, and so that's actually one of my inspirational points for why I do what I do is because I know the consequences that her death had on my family all these generations later. My grandfather, one of the first three sentences he would always say to introduce himself is his name, where he lived, and that his grandmother died his mother died when he was 3 years old.
wow.
Yeah. So it impacted
It
him
stayed with him.
his whole life.
Wow.
And, he was always concerned, about the women in our family when we were giving birth and how things were going. And they, even though they were very poor, he had his wife go to the nearest big hospital to give birth because he was worried about that.
Yeah, yeah,
And so, that, came through our family,
yeah,
and they had a lot to struggle with a lot of things,
yeah.
with alcoholism and a very sad, despondent husband who had lost the love of his life.
Yeah.
And then he had these tiny little boys and a brand new baby that he couldn't take care of. And so a long history of a story in our family. And then my other great grandmother was a midwife and had learned about all the healing plants in our area because she'd lived surrounded by a Native American tribe around a fort in Canada. And so she was taught by the medicine woman of that tribe about all the healing plants of the prairie.
Yeah.
So I grew up with stories of her that she had her jars of herbs that she would grab and make different drinks for the people that she cared for. And the women that she took care of survived pregnancy. And so it's such a legacy of both of their stories. It's nice to be able to honor them. I usually talk about them when I speak. It's nice to honor their memory.
That's wonderful.
Yeah.
What a beautiful legacy. Thank you so much for sharing that. I appreciate it. I've gotten a good picture of the benefits of vitamin D, right? So we've talked maternal health, we've talked aging, we've talked mental health, we've talked pediatric population, And then there's obviously so much more that we won't be able to cover in
Ooh.
one conversation. The importance of
We should do sports.
sports. Okay,
People
yes.
who are into sports, let me tell you what.
Okay.
Oh my gosh. They did studies that for sports teams, if you get your vitamin D levels up higher, guess what?
Yeah.
Less sick, less TBI, less injuries.
Wow.
I mean, come on. Like, so for our sports people too, you want to play longer, jump higher, you know, run faster.
This message needs to spread like wildfire. I think everyone from the fetus and the mother's belly to the aging, to the older adults, everyone can benefit from it in some form or the other. After this, I'm just going to run out and go get some vitamin D and tell everyone I know, make sure you're taking vitamin D, check what your dose should be on the calculator, and go load up on vitamin D and C. And it'll be interesting to see just what their outcomes are. And I'll be talking to my friend, telling her to give her
Well, I'm
daughter.
excited to see what you see in your practice as a nurse practitioner.
Yeah,
right?
well, that
It'll be fine.
that is my hope, is that when, and I'm obviously practicing in real time, I'll be able to share this information with my patients, right? Get out in the sun. This is the time where, we're in spring, right? So get out in the sun and go take a walk. Sometimes people don't want to do that because it gets them too tanned. By the way, if you put sunscreen, does that block anything?
Yes, and it does. And so that's, I think, the best sun recommendations, come from Australia, because they really look at the skin tone of the person. They're the first nation to address sun exposure by skin tone. So they have recommendations for the lightest of skin tones all the way to the richest of skin tones. I tend to wear makeup with sunscreen in it. So I have to be very mindful.
Yeah.
If I'm going outside to intentionally try to get vitamin D, I have to pull up my sleeves, and to get some skin out there. Yeah. Otherwise, my makeup is going to block it. It's going to block a huge amount of the rays hitting my face.
Yeah.
And so we have to be very mindful of that. I think maybe 10 years ago, 15 years ago, they were trying to tell moms, slather your children from head to toe with sunscreen, but you're blocking the vitamin D. So you need to let everybody needs some time. You don't want to burn, of course. That's obvious, but you need to have time
where it's just exposed.
You just get a little flush, so that you're getting some sun on your skin, because otherwise it also repairs your skin. You have a higher risk for melanoma. If you have low vitamin D.
Yeah.
So you really want to be mindful that you're getting some sun exposure before you put on sunscreen or use a hat. And chemical-free sunscreen, please, people, follow the Hawaii recommendations. Yeah. We don't want to be putting endocrine disruptors on our skin.
Yeah.
Right?
What is a good amount of time per week to say, okay, 30 minutes every day or 3 days a week to get out in the sun?
It kind of depends on your skin tone. And where you live in the country, of course, but I could generally, if people are very fair, like I have some friends that are red hair, freckles, very fair, really acclimate from winter to summer, even just have your feet out for a little bit, start with 1 minute, 2 minute, 3 minute, 4 minute.
That's good.
You really have to acclimate if you're a very fair skin tone, and I think for my friends, especially my nurses that I educated who are from, African cultures, one of my nurses said, you know what? I just had to tell people, I want my kids to be healthy and get sun exposure. I don't care if they look darker because they're out in the sun. And she's so boldly educating all over that on TikTok now. And I'm so proud of her because she makes her kids go jump on the trampoline without a shirt so that they can, and because when I told her, really, it would be an hour and a half for you to generate the same amount that my Celtic ancestry friends can do in 15 minutes. I mean, she was so shocked. So she's like, get outside, get on the trampoline. You guys are jumping. So whatever you can do, obviously, if you're working and kids are in daycare, you can't control a lot of that.
Right.
But you can, encourage them, and you can educate their daycare provider. So, we just have so much power as healthcare professionals to educate our communities. So
yeah, that's awesome.
Grassroots Health has tons of great information on that. I'm going to be having my own website soon, drbethsanford.com. I'll have information about that too. And have opportunities for speaking engagements. So
that's wonderful.
There's so many wonderful opportunities out there to all of us to learn and grow in our sun science and vitamin D knowledge.
Yeah. All right, let's do a quick one, a rapid fire with Dr. Beth, right? Sunshine Edition. Sunlight or supplements? What's your go-to?
Sunlight first, supplement second.
Awesome. What is your favorite place to soak up the sun?
Ooh, I love to hike. So I'm outdoors, outside hiking in the national parks. That's my
Awesome.
favorite.
What is one food that you wish had vitamin D in it?
Ooh, if I wish had more vitamin D in it, it would be cheese. I love cheese.
Cheese.
I love cheese. I can eat cheese all day, but it doesn't have very much vitamin D, if any. I wish it had more. I like cheese.
What is the biggest myth that you hear about vitamin D? Busted in one sentence.
In North Dakota, that we can generate it in the winter. Nope. And north of Kansas, you can't generate vitamin D in the winter. So you got to supplement. That's it.
Awesome. If vitamin D had a theme song, what would it be?
Ooh, Walking on Sunshine.
Walking on sunshine.
That's it. Right. Or Here Comes the Sun by the Beatles. Here comes
Awesome.
the sun.
Yes.
Right.
Awesome.
And it's all right.
Nice. Okay. What is one thing that if you could give like every nurse in America one prescription, what would it be?
Educate.
Educate.
Do our best that we can do as nurses and educate. Educate your communities, educate your families, educate your peers. The best gift that we have as nurses is our power to influence through education.
Awesome.
And you sharing about vitamin D with someone could impact their risk for breast cancer.
That's amazing.
I mean, or maternal health outcomes or mental health outcomes. Like educate.
Yeah.
That's our superpower as nurses, is
Absolutely.
our ability to influence through education.
Yes, for sure. Thank you so much for sharing that. We are going to move real quick to our game section now. Are you ready?
No, I'm ready.
Okay, so first, I always ask all my guests if you watch any shows. If you don't, I'm sure you've seen media, you know, what nursing portrayals are like. Can you tell me what your thoughts are about how nurses are portrayed in media?
Nurses typically are not portrayed as being very bright
Yeah.
in the media, which has always made me laugh.
Yeah.
You know, either mean and crabby, which could be sometimes true of nurses, or else super sexy, that they're just the attractive, sexy sex toy. You know, I don't know. Yeah, nurses are usually not portrayed as being intelligent.
Yeah. Thank you for sharing that. Okay, so let's go ahead and play our game. You know how it goes. I'm going to shake around my jar, pick a category, and it is up to you to create the plot for a show that features a nurse character, a nurse lead, how you would like nurses to be portrayed, right? Okay. Let's shake this around. I don't have a vitamin D category, unfortunately. That would have been awesome. Okay.
Well, I'll weave it in.
Okay. All right. So your category is interesting. It is sci-fi.
Okay. All right. Okay. I would do a really savvy nurse. Okay. She grew up reading Nancy Drew books.
Nice.
So she's like a detective, right? And she just started this new job in this long-term critical care hospital. And as she's working there, she picks up a shift on nights and notices that all of a sudden the patients are starting to change.
Oh.
Yep. They're starting to change, like they're turning into zombies.
Oh.
Right. Yep. And some of the nurses are turning into werewolves and all these mythical creatures.
Wow.
And she can't figure, you know, and she thought, you know, she shakes her head. Oh my gosh, is this real? Like, am I imagining this? Mm-hmm. You know, she's just busy working, and she, you know, and it's not a dangerous level, but she just notices the features are changing. Okay. So she goes back to days and she does a little research, and she thinks, okay, what could be going on here? What's going on with these nurses? You know, what's going on with these patients? And then she finds out through her study, she's like, you know what? I think that they have a deficiency.
Okay.
So she goes into the cupboard and she looks and she said, "Oh, they do have some." And during the day, she talks to the doctor and says, "Hey, can we try this?"
Mm-hmm.
So everybody is given a serum. All the patients are given a serum, and then the nurses are educated and they get a serum. And all of a sudden, people start coming back. The brightness starts coming back to their face. You can see more joy. The patient's outcomes are improving because guess what? They were sunlight deficient and they needed vitamin D. Yep, they needed some vitamin D to fill the gap in the sunlight deficiency. And all the night nurses became bright and happy and started singing "Walking on Sunshine."
The vitamin D theme song.
So we went from darkness to light.
To light. Oh, hallelujah.
Yeah.
Thank you.
And then she walks away and puts her glasses down.
I love it.
What a and has her journals in her hand.
Yeah, that's awesome. You definitely wove the vitamin D in there. All right. Can you tell people where they can find you if they want to connect with you or get a consultation for vitamin D wellness?
Sure. Yeah, right. You can find me on LinkedIn. I'm Dr. Beth Sanford. Like I said, within a couple weeks, I'm going to have my new website. Probably by the time this podcast airs, my new website will be up and running, drbethsanford.com. And you can find me through Grassroots Health Nutrient Research Institute as well. They can find me there, but
awesome.
I'm pretty easy to find if you
if
you need a little sunshine expertise.
Yes,
I'm on it.
Yeah, thank you so much for sharing. I will link all your information in the show notes. Your research, you've done a whole bunch of research and you're so active in this work. So I'm going to list all of that. I'm also going to list the calculator in the show notes and really just where you can find Dr. Sanford to connect with her. If you could recommend anyone to be a guest on this show real quick, who would it be?
Oh, you know so many of the people that I know.
I know. We know the same folks already.
Now we know a lot of the same people. Oh boy. Can I think about that?
Yeah, of course. You can think about it. You know where I am. You can let me know. Yeah. Thank you so much for being a guest today. Thank you guys so much for tuning into today's episode. I hope this has given you some insight really into the world of nursing and all the roles that we can step into. Really grateful to have had Dr. Beth on here today talking about vitamin D. Guys, go out and get all the vitamin D you can get and just start taking it. You might start walking with a little more pep in your step. No. But thanks for listening, and we will see you guys in the next one. Bye-bye.
Thank you. Bye.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.